Hello everyone, welcome to the project module. Today we will be talking about the introduction to the research. Uh, People who didn't meet me before, so my name is Dr. Salih, health and social care lecturer at school system in the partnership with Leeds Trinity University. So the learning outcomes covered in this today lecture. So for this module, guys, you will be have to research a topic of your choice related to health and social care. So today you will be identifying a suitable academic topic that is related to your field of study, which is health and social care. So let's ask ourselves, what is the research? Okay, so what is the research? So from the basic way, so we can say research is investigation. So when you are investigating something, that means you are researching. Okay, so the proper definition, research is a systematic investigation, so aimed at the discovering a new information, verifying facts, and reaching new conclusion. So there's a types of research. There's a two type of research: the basic research and the applied research. The basic research, which is focuses to increasing the knowledge. The applied research, which is focuses on practical application. So if you are working in the lab, for example, you are searching for or researching for the cancer drugs or cancer treatments. So that's called applied research. So why the research is important? Important because it drives to new innovation, so and challenges existing knowledge and open doors to new discoveries. Okay, so why do we conduct the research? Let's ask ourselves why we do research. So we do research for three or four things. For example, one of them are to build knowledge. Once you build the knowledge, so that's mean why we conducting the research. Building knowledge so helps us to understand the world, test theories, and solve problems. Also solving problems. So that is one of the why we conducting research. We conducting research because we need to solve some available solving. We need to solve out some available problems. So research allows for the identification of solutions, critical so, uh, issues, including health, technology, and education. Also, we conduct our research for the informed decision making. When we do some decision making, we are conducting the research so to provide the necessary data for making informed evidence-based decision. So let's have a look. What is the healthcare research? Okay, what is the difference from the general research? Okay, the healthcare research focuses on improving health outcomes, preventing diseases, and enhancing to delivery of care. Types of healthcare research: clinical research, health service research, translational research, and also uh, there's some applied research or clinical trial we call. Okay, so the clinical research studies intervention and their impact on health, and health service research which examines health care is derived, and translational research which is converts basic research into the practical applications. What is the goal of healthcare research? So what is the target? What is the aim of the healthcare research is to improve both individual and population health. Okay, so let's talk about the historical impact of healthcare research. Major discoveries or improve the life expectancy or transformational technologies. So the major discoveries can be developments of antibiotics such like penicillins, or for example, developments of cancer treatments, or developments of for example, diabetes treatments or cardiovascular treatments, or the vaccination, such as a smallpox or COVID-19 in the vaccination, or advanced surgical techniques such as laparoscopy. Okay, laparoscopy is the techniques that can be used for surgery, and laparoscopy, uh, which is the techniques that can be used to do the surgery. Improve the life expectancy. Okay, so the medical research also lead to the significant reductions in mortality rates from the infectious diseases, cardiovascular diseases, or cancer. So the transformational technologies like MRI, CT scans, or any pathological tools that's used to analyze the disease, or the only genomic screening and transformed diagnostic capabilities. Okay, so how research continues to shape modern healthcare. So personalized medicine, digital health innovations, and public health. So for the personalized medicine, so the research is helping uh, to 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 come up with any personalized medicine, such like research in the genomics and biotechnology enables treatments to tailor an individual. For example, if we are targeting cancer therapies, so that can be one of the examples of the personalized medicine. So, and also digital health innovation, such like telemedicine or wearable health technology and AI assist. So, or assisted diagnostics are improving access and quality of care. The public health advances, ongoing research informs the policies that tackle global health challenges such as pandemics and chronic disease, such as, for example, pandemics like COVID-19, or chronic disease can be cardiovascular disease or long-term conditions. Okay, so the importance of continuous research in healthcare, which is keeping up with the emerging treatments, so is crucial for addressing new healthcare threats, such like antibiotic resistance or new viruses. So also improving care standards. Research is also constantly refining the standards of care to ensure patients receive the most effective treatments. So reducing healthcare disparities, research highlights inequalities in healthcare access and outcomes, driving policy changes and improvements. Okay, so let's now we know what is the research and what is the healthcare research, the types of healthcare research, and the types of research. Now let's talk about what is the evidence-based practice. It stands for EBP. So evidence-based practice is the consensus use of current best evidence in making decisions about the patient care. So if you are making a current decision about any patient care, that's the definition of evidence-based practice. The core component of the evidence-based practice is the best available research evidence and clinical expertise and patient values and preferences. Why the evidence-based practice methods are important? Because it ensures that care decisions are grounded in proven effectiveness, leading to better health outcomes. Okay, the evidence-based practice process can be asking the right questions, searching for evidence, critically appraising the evidence, and applying the evidence. Okay. Uh, Impact of evidence-based practice on the patient care, which is improve the outcomes, thus leads a better patient outcomes by ensuring treatments are based on the most current and accurate information. Also, consistency in care and also patient-centered care. By considering the patient preferences and values, evidence-based practice makes healthcare more personalized and relevant to individual needs. So, challenges and the future of research in healthcare. Let's speak about the challenges. So the challenges of healthcare research can be funding limitation because there's very less funding available nowadays, or ethical consideration in clinical trials. So when if we need to conduct the healthcare research, we need to have like ethical consideration or ethical approval from from authorities. Okay. Also, the barriers to implementing research in practice. The future directions, so increasing focus on patient-centered outcomes, more collaboration between the health providers and researchers. For example, if you're working on the education institute and you're conducting a scientific research, you need to have a collaboration with any healthcare sectors. Like, for example, if you're working within the University of Bradford, developing the cancer treatments for any types of cancer, you need to have a networking or collaboration with NHS, such like, for example, uh, Bradford Infirmary, Royal Infirmary Hospital, which is they have got a research going on, so can be a collaboration between in two institutes. Okay, so and also use a big data and AI to enhance the research capabilities. The ongoing need to research continuous investments in research is critical for advancing healthcare, improving treatments, and addressing emerging global health challenges. Okay, let's talk about the research process. So you start the research with to produce a research proposal, and then to start your literature review, which is like critically analyzing the previous studies for the specific topic or for the specific title that you are conducting the research on. So, and then, so you will design the methods for data collection, which method you are going to use, if it's applied research, so, or for example, if it's quantitative or qualitative research, you need to follow the steps or the objective to follow to collect the data. And then you start collecting the data, then you will start answering the research question or finding your aims. Okay, so that's called the key finding or the results. And then you will do the results interpretation, and then you need to conclude your results, a conclusion, and then the recommendation can be the further. What is your further insights or further aims? Okay, so and then you can submit through the institute, okay, or you can submit to the journal for the publication. Okay, what is a research proposal? So a research proposal is a summary of your research, of your proposed research. Research is a careful and detailed study on a specific problem concerned or issue using a scientific method. That is why the importance of the plan before is very important to plan before you conduct any assessment. Okay, so it is sets out the central issues of questions that you intended to address. Okay, what will be included in research proposal? So as we said, it's a very summary of your planned research. It outlines the center issues or questions you intended and also the background and significance of the research and the methodology and plan of completing the research. Okay, so creating a research title, you should have a clear title for your research. Okay, so made up of relevant keywords. It should also give an indication of the intent of your project, directing attentions explicitly to the central issues that you will address. Your title also should be very clear, and then also it's important to specify what a population will be investigated in the project. So we should have very clear title and very interested title as well. So our inclusion and exclusion criteria should be very important as well. So which population you are looking for. So elder people, young people, or so on. Okay. So good and bad titles. Good titles properly. So properties. Let's have one of the example. So the good title can be comforting kids. For example, how nurses help alleviate cooperative anxiety in tonsillectomy patients. Okay, so the bad title can be wider, such as anxiety and surgery, chronic disease in UK, for example, or if we say diabetes and exercise, that's also is very wide topic or title. So we need to narrow it down and we need to have very specific topic. Okay, backgrounds of the project aims and objectives. So what is the structure we need to include when we doing the research? The background of the research or the introduction of the research, which is provided a detailed overview of the topic you're researching on, including the historical context and what is already known about. Also can be discussed the current challenges, controversies, or gaps in knowledge within the field. Also, critically analyze and summarize relevant study theories and research findings that have been previously conducted around the research. The aims and objective, the aim of the research, which is what are you trying to achieve? What is your goal? Okay, to from conducting this research. This is the aim of your research should be as well very clear. Okay, so also so breaking down the aim into the specific, measurable, achievable, relevant, and the time I'm bound. That can be stand for SMART objective, and also justify why each objective is important. So what is the objective? Objective means steps that you follow to achieve your research aim. Okay? Objective can be the methods, techniques that you use to collect the data. Okay, let's talk about specifically about the aim. Aim of the project is clearly defined as a goal and objectives, outlining what is intended to be achieved. Okay. Also, it is important to specify the purposes and the desirable outcomes of the project. The aim should reflect what you hope to accomplish and impact you aim to make. The statement help guide the project by providing a clear understanding of the intended direction and purpose. Okay, as I said, so I don't want to read out all of this, but from the basic side, what is the objective? Objective is the methods, the method of your research, the research methods means the steps or the techniques you take to achieve your aims. Okay, so research question as well also should be very clear and concise, significance and justification, and you should critically thinking and new insights can be manageability is important as well, and practical application. Okay. In summary, research question play a pivotal role in the shaping the research design and methodology. Therefore, it is imperative uh, to formulate the clear, concise, and justifiable research question that guides the study effectively and contribute to the existing body knowledge. Okay, so let's talk about how to narrow down the topic and how to search on the specific and focus the topic, narrowing down the topic. So why is the narrowing down in the topic is important? Because you will be focusing on a specific uh, research title. Okay, so uh, when we narrow down the topic, so we need to start with the broad topic, such like, for example, heart disease, and then identify a specific aspect of the subtopic. For example, the heart disease example focus on the prevention of heart disease. Okay, so and then we said start with the broad range and then identify the specific aspect of subtitle. Also, select a target population. So if we are saying on the prevention of heart diseases, we need to specify a population. Said, for example, heart disease prevention in older adults. That could be the inclusion criteria only can be in older adults. So heart disease in rural communities is in only researching the heart disease in rural community is not in like developed cities or developed countries. Okay, so also choose a specific variable or relationship to study. Decide what is specific aspect or relationship you wanted to explore within your subtopics. For example, so effect of physical activity on heart disease risk in older adults. Okay. So also formulate a research focus and questions. Combine your narrowed focus into a clear research question that guidelines your studies. Also, so create a final concept title. Construct a research title that reflects your specific focuses, population, and variables. Okay, for example, exploring the role of physical exercise in reducing heart disease risk among older adults. That can be a final concept of title. Okay. So summary example, let's give you summary example for some students who conducted their research previous years or last years. So the broad topic was heart disease, and then they narrow it down to the subtopic, which is prevention of heart disease, and then targeted population was older adults, and the specific relationship was impact of the physical exercise. And the research focus question was, how does regular physical exercise reduce heart disease risks in older people over 60 years? The final concept was exploring the role of physical exercise in reducing the heart disease. Okay, so we need to start with broad topic and narrow down to the subtopic and targeted population, then a specific relationship, and also research focus question, and we need to specify the final concept title. Okay, so the research methodology, from what I see, we need to have research methodology. There's three types of research methodology, can be qualitative, quantitative, and mixed methods. So the definitions, okay, of the research method, we said there's three types, which is quantitative, qualitative, and the mixed. So first of all, we need to approach to the question strategies perspective used in the address. Example, qualitative, which is exploring the experiences of patients through the thematics analysis, or quantitative, analyzing the statistical data to identifying patterns or correlations. So a mixed, which is combining the quantitative and qualitative approaches for a comprehensive analysis. Also, number two, so the research design. So what is the research design? Is the overall structure of the research process. Example, descriptive design, or comparative design, or systematic review. This is a type of the research design. Research design or research methods means how you want your research. Do you want your research like descriptive, observational, comparative, or systematic review, or meta-analysis? Meta-analysis is like a statistical tool that can be conducted in the research. So also, number three, you need to look for the inclusion and exclusion criteria. What is the inclusion? Okay, what population you going to include in your research? Which one you are going to exclude in your research? The purpose of doing this, the criteria that determine which studies or data will be included or excluded. The example of inclusion, examples such as published within the last 10 years, research focus on the adult age or 18 and above. For example, if you are searching, so if you are doing, so for example, clinical meta-analysis, so for example, you are looking for the population that's published within the last 10 years. Okay, you need to specify the publication years, 10 years, 5 years, or 6 years. So the exclusion example, or also the inclusion example, you need to specify the age-wise, the sex-wise, like females or males. Okay, children or adults. Okay, exclusion, non-peer-reviewed article. So studies not published in England, for example. So sample procedure. So methods that used to select the data or study for the review. Example, cross purpose sampling and the systematic sampling. The ethical issues, the ethical consideration can ensure the secondary data is used, sorry, so it's ethnically within the proper citation and permissions. Maintain objectivity and integrity when interpreting and presenting the research finding. Also, we need to avoid the plagiarism by appropriately referencing all sources and background, acknowledging the original authors. Okay, the research methodology overview, which is the theoretical resources, uh, and the definition is theories, models, and framework as guidelines that support your research. The purpose of doing this, which is provide a foundation for your analysis, offer a lens for interpreting existing literature and contextualize your study within the broader academic fields. So examples, the heart disease, as we said, this can be biomedical theories, the risk factor, behavior models, can be health belief models. Asthma, environmental health theories, environment exposure theories. Diabetes, for example, public health frameworks. The key consideration for which is the relevance, we need to do the relevance and choose theories directly related to your research questions. Applicability ensures the theoretical resources can be applied to secondary data analyzing, and then credibility use well established and peer-reviewed theories. Okay, so we also need the research approaches, uh, definitions as structures, concepts, guidelines, interpretation of your research. As a purpose, which is organize your study, provides clarity, and shows how your research contributes to the existing knowledge. Types, as we said, descriptive, explanatory, or critical. The research methodology can be the research method can be secondary research, use existing academic literature, books, reports, no primary data collections, and the data analysis techniques, literature review, context analysis, and also the key consideration which ensure sources are credible and relevant, and also critically evaluate the quality and applicability of each sources. Clarity defines how the choosing methods align with your theoretical framework. Okay, so how to plan and time schedule this can this is called Gantt chart. So Gantt chart, which is your action plan. So the timeline, so the time management, thus your research can be done. Okay, you need to create a Gantt chart or a table. For example, if you're conducting the research for next 3 4 months, you need to put the timelines for the research. Okay. For example, you say week 1, week 2, which is research plan preparation, week 3, which is the teacher review, week 5, 6, method developments, week 6 to 7 can be data collection, analysis, week 9 to 10 can be writing draft reports, week 11, 12 can be, for example, the review final submissions. Okay. So, but this can be different from the level of your study, from levels of your research. For example, if your research is a secondary research, so that can be, for example, a couple of weeks, couple of months. If your research is, for example, to have a master degree, this can be, for example, up to 2 3 months. Your research to fulfill the to complete the master degree, you should have a research for 2 to 3 months. If you're going to have a PhD, that is 4 years long. So thus you need to put your Gantt chart. So just 4 years. First year, what you need to do. Second year, what is your plan? Third year, what is your plan? Fourth year, what is your plan? Okay, the referencing, we should, the purpose of doing referencing, which is provide a list of key academic articles, books, texts relevant to your research proposal. Highlight sources that support your theoretical framework, methodology, and research. Okay, so include key articles and texts, select the most relevant and frequently cited work is in your research area. Example, original theories or models are using. And variety of sources use a range of sources, including journal article, books, reports, and review. Referencing style, of course, we agreed in this institute to use APA 7th editions to consist formatting. Include authors, year of publication, title, journal, book, and volume, issues, and DOI if available. So you will be learning how to do the APA referencing style in next couple of weeks. Okay, referencing example. So you can use, as we said, journals, articles, books, text. Okay, this can be example. You need to put the journal names and the title, for example, which is can be the role of the GPs in integrated care system. A guide general care, or for example, you can speak about the what is the publication and the website. You can put the link for the website as well. Okay. So, any questions? Let's wrap up today, guys. Let's summarize. Today, we talk what is the research. We say the research is the investigation. Types of the research. It can be basic to build our knowledge, be applied research, which is to develop any kind of works working in the lab can be applied, which we can say from bench to mark. So, and we talked about the evidence-based practice as well. We talked about the health care types of healthcare research, okay, and then we talked about the research method. We talked about the research methods, and we talked about how we can conduct the research, and also we talked the research design and how we can conclude and interpret data. Thank you for listening today. So good luck with everything. See you next